Probably the most important part of caring for your baby is breastfeeding. Everyone knows how important it is, and yet every new mom has questions about it. That's why we included breastfeeding in our video series to help with at-home newborn care. A first step in breastfeeding is setting the stage. Create an atmosphere where you can relax. So you're not interrupted, take the phone off the hook and turn your cell or smartphone to standby. Gather the things you will need, including pillows, a burping cloth, and a glass of water to drink. Keep them all nearby. While washing your hands is important, it is not necessary to wash your breasts or nipples before breastfeeding. Try to be ready before the baby wakes up so that the baby is not crying when you start to feed. To start, position the baby so that the baby is lying on the side facing your breast. Bring the baby to the breast, not the breast to the baby. Make sure the baby is positioned tummy to tummy with you and to the level of your breasts. Line up the baby's nose with the nipple. Bring your baby onto the breast by supporting the shoulders, neck, and head. Make sure your hand is not at the back of the baby's head. The baby needs to be free to self-attach. If the baby is hesitating or not opening the mouth wide enough, try to elicit the rooting reflex by tickling the baby's top lip and nose with a nipple. When the infant's mouth is open wide, bring the baby in quickly. The baby's nose, chin, and cheek should be touching your breast. Your baby can breathe through their mouth and nose. While breastfeeding, your baby should not cause pain or discomfort. You should hear or feel the baby suck and swallow without any clicking sounds. If you hear clicking sounds, this means that there may be an improper latch-on and the baby is not feeding properly. Break the seal between the baby's mouth and your breast by inserting a clean finger into the baby's mouth. Then reposition the baby onto the breast with a tighter seal. Also, the baby's cheeks should not be sucked in or appear hollow. The initial latch-on may be uncomfortable for the first minute, but then should ease up and feel like gentle tugging. If breastfeeding continues to be uncomfortable, the latch-on may be the problem. Retry the latch-on. It's not unusual to have to do this as much as 10 to 20 times to gain a proper latch-on. Be patient and keep trying. Remember that when it comes to breastfeeding, some feedings may take longer than others. Breastfeed as long as the baby wants to nurse on a breast. When your baby stops sucking on the breast or takes long breaks, try burping and then offer the other breast. When possible, try and use both breasts during feedings. This allows for softening of both breasts, prevents engorgement, and improves milk supply. However, it is all right if your baby falls asleep after breastfeeding well on one side. Remember that breastfeeding works on supply and demand, so don't limit feeding times. Babies know how much milk they need on their own. Watch the baby, not the clock. If the baby falls asleep after feeding on one side, offer the other breast when you start the next feeding. Nurse your baby every hour and a half to 3 hours during the day. Measure the time from the beginning of a feeding to the next feeding. Expect to nurse your baby 8 to 12 times in 24 hours with a minimum of 8 feedings. Some babies will cluster feed. This is when the baby will feed several times in a row, such as every hour for 4 to 5 hours in a row. Offer your baby the breast whenever you see signs of hunger. These include smacking lips, sucking motions, sucking their hands, or moving toward the breast when holding. As far as night feedings, it is normal for babies to wake throughout the night for breastfeeding. When your baby no longer needs to breastfeed during the night, your baby will naturally stop waking. You don't need to teach your baby to sleep during the night. Feeding frequently during the daytime may help your baby sleep longer during the night. I know from talking with many new moms that successful breastfeeding requires patience, devotion, and a loving approach. We hope this at-home newborn care video has helped. If you liked this how-to video on breastfeeding, look for the Breastfeeding Basics video for more information.